Well, thank you so much. I appreciate you all having time and space to talk about coping with cancer. Next slide. So, before we jump into how we can cope with cancer, I think defining cancer distress can be really a helpful framework so we know how to implement strategies that are going to be most effective for us. So, there are a lot of different definitions of what cancer distress is. One of my favorites is this one, which is founded from the National Comprehensive Cancer Network, or NCCN. And they define cancer distress as these four broad domains of psychological, social, physical, and spiritual distress. And you can see within these colored aspects, or kind of the rainbow color, there are a lot of different side effects, emotions, symptoms, relationships that can be impacted as we navigate through the cancer experience. It's a very wide, and diverse definition, and I think it really highlights just how challenging, the cancer experience can be because we're impacting our social relationships. It can give us side effects that can impact our physical, ability to engage in the things that we typically enjoy doing. It can lead to different spiritual and also emotional challenges that maybe we have never, thought about or experienced in the past. Next slide. For the purposes of our conversation today, though, I'm going to focus a little bit more on the psychological piece of cancer distress. And what we know from past literature in kidney cancer, next, is that next animation. Oh, there we go. Thank you. That approximately 32% of individuals will experience clinically significant levels of anxiety, but up to 91% of individuals may experience symptoms. So, this is a really high statistic, and I think really speaks to how challenging and stressful the cancer experience is. When we think about depression, next animation. Approximately 20% will experience depression, and up to 87% may experience symptoms. So, again, this is significantly higher than what we would experience in just an adult population, non cancer population in the United States. And again, really speaks to the challenges that can come up within our cancer experience. So when we think about some of the symptoms that can come up, we have, these 91% of individuals with anxious symptoms, 87% with depressive symptoms. And so for each person, that might look a little different, right? We might have feelings of nervousness going into scans or as we wait for the test results to come back that make it really difficult to concentrate or engage in our day-to-day activities. We might also experience loss or we want to isolate because we just don't want to answer any more questions about our cancer experience. And from looking at research specifically in kidney cancer, we've kind of looked at the cancer continuum of from newly diagnosed all the way through. And what we have found is that some individuals, particularly newly diagnosed patients, may be at increased risk for some of these symptoms that we're experiencing. There are a couple thoughts about why this might be, but I think a lot of it comes down to a lot of the uncertainty that comes with a new diagnosis. We have to manage our schedules, our regular life doesn't stop. And then we have all these uncertainties about what is my treatment plan? What are going to be the side effects that I might experience from treatment? So it is a really lush time to increase and experience an increase in a lot of these symptoms. Next slide. I think this slide is really notable for a couple reasons. So this study looked at just general stress in folks who were navigating through active treatment for kidney cancer. And the authors of this paper asked participants just to answer a few questions about stress generally. And from those answers, they were able to create this composite score that showed low, moderate, and high levels of stress. What I think is really notable about this study is that approximately 94% of individuals were endorsing stress at a moderate to high level. And I think it really speaks to not only is this a stressful experience that a lot of people experience, but it's a very highly stressful experience. And so we know that we can experience stress while navigating through cancer. And so the next step then is how do we manage? How do we cope with the inherent challenges that come up during the cancer journey? Next slide. So that leads us into awareness of our stress. So we all experience stress in different ways. Some of us might experience more physical symptoms of stress. Other folks have a lot of thoughts and feelings or emotions that come up in the context of stress. And even other folks have different behavior changes. And oftentimes we have a mixture of all three domains, but it can be really helpful to take note of how stress typically shows up for you. And so I'll encourage you just to think for a moment about maybe when you received your diagnosis, or maybe you had a scan and you were waiting for test results. And what were the things that were coming up for you? What were those experiences that you had? And for some folks, it might be, again, those physical aspects of I feel more fatigued, I have difficulty falling asleep, I get a lot of tension in my shoulders or my jaw. For other folks, they might be more irritable. They might snap at their loved ones or not be interested in doing the things that they usually enjoy doing, or kind of feel a sense of helplessness or that nothing can change. And other folks might engage in more behaviors. So it could be, again, isolating, as I mentioned earlier, or perhaps engaging in eating changes. So maybe coming home after a difficult day and opening up that freezer door and grabbing a tub of ice cream as a way to cope with the stress. But whatever way that you experience stress, there's no right or wrong way. It's just unique to the individual, can be a really helpful roadmap to move forward. So if we are notice that we can experience more physical symptoms of stress, those can be really helpful early warning signs that we can then intervene on before it gets to kind of 100% or really high levels of stress that often feel overwhelming for us. Next slide. So when I talk with folks who come into my office, we often talk about the sense of the cancer experience feeling a lot like a roller coaster. We're strapped in and we're on the ride. And there's a lot of ups and downs that accompany that ride. And in the up or high times, we might experience feelings of joy, of gratitude. And in the low periods, we might experience feelings of loss, irritation, stress. And it can often feel like when we're strapped into this ride, we're just going and we have no control of when the ride is going to stop or kind of the speed or kind of how long that we're on the ride. And this can really be triggered by something that is inherent in a lot of our cancer experiences, which is disease uncertainty. Next slide. And with disease uncertainty, this is something that comes up often throughout our cancer journey, and it can be caused by a lot of different things. There's a couple listed here. One being an unpredictable cancer course. We can have fear of recurrence. There can be treatment uncertainty of is this going to work? Is it not? We can have how it impacts our future plans or the hopes or dreams that we were envisioning for our future. And it can really lead to this sense of loss of control. Next slide or next animation. Thanks. And those causes and disease uncertainty can impact a lot of different areas, right? It can impact our emotional distress. We can have more difficulty coping, not only with our cancer experience, but also just the day to day responsibilities that don't stop just because we have a diagnosis. It can lower our quality of life. It can contribute to some strain in our relationships and tension that may not have been there or exacerbate some challenges that were already existing. And again, it can lead to that isolation piece, whether it's physical isolation of we want to reduce contact with other people while we're going through treatment, or some of that emotional isolation of no one really gets what it's like to navigate through this experience. And it's really hard for me to see other people living a life that I was once living. And so that leads us into a really helpful strategy of managing uncertainty, but also the feelings of loss of control that can often accompany when we feel like we're on this roller coaster of our cancer experience. Next slide. And in this, way, I often ask patients two different questions to kind of start this conversation of how can we cope with cancer, whatever it has been given to us at that given time. What can we do? And so the first question I often ask folks is in your cancer experience, what might you be able to control? And what can you not control? And I'll maybe give you a moment or two to kind of think about how that might fit for you. And when we're talking about this with patients, I often sit down and we just kind of write down. We have two columns. We start it with what we can control and what we can't control. And we generate a list that looks a little bit like this next to animation. And so we might have listed out controllable aspects of our cancer experience, like choosing our cancer care team, or for some folks, the ability to choose the healthcare system that they receive treatment in. Or another controllable aspect of is choosing what to put in your body, whether it's what we eat, what we drink, medications that we take. And then we do the same for the uncontrollable aspects. And we can generate a list that looks like this next animation, right? So we can't control our cancer response or progression. We can't control the side effects that we will have from treatment or the reactions or behaviors of our friends and family members. And so, what writing out these controllable and uncontrollable aspects does is it often contributes to a little bit of a perspective change. So, oftentimes it's easy for us to identify and feel like there's nothing within our control. And this really forces us to be able to see 100% there are things that I can't control, no matter how much I wish I could. And there are pieces that I can actively do or control and try to adjust for. Next slide. So with that, we have kind of our list, right? We have our controllable, we have our uncontrollable aspects. And then it comes to phase two of what do we do now that we have this list? And for controllable aspects, next animation, we can utilize something called problem focused coping. So this is a type of coping strategy. It's kind of an umbrella term that really focuses on changing a controllable aspect of a problem to reduce stress. So, identifying what's within our control and then doing something active to try to change that piece of it so that the stressor is a little bit less intense or overwhelming. For uncontrollable aspects, we utilize something called emotion focused coping. So, with that uncontrollable piece, again, no matter how much we wish we could try to change it, we can't. And so then the task becomes how can we change our internal response to the problem to reduce stress? Next slide. So, putting that into practice, I have just a general list of what that looks like. So, for problem focused coping, we can do things like setting goals, we can take our medication. So they're really active ways to kind of meet and address those controllable pieces of a stressful situation. We can also rely on informational social support. So if we think about informational support, these are the folks who might come to your medical appointments with you. They might write down questions. You don't forget to ask your oncologist about them. Maybe they do the first pass of research on the internet and they come back with a few lists of reputable sources. You don't have to just comb the entire internet for what you're looking for. Or you could utilize task-oriented support. So these are the folks who might come over with a lasagna after surgery or after treatment. They might, offer to take your kid to soccer practice if you're feeling fatigued, or come over and vacuum for you. But they again, have those. They address some of the problems, some of the stressors that are within our control in a given cancer experience. For the uncontrollable aspects, that leads us into different exercises like relaxation or mindfulness practice, or even a gratitude practice. And when we utilize gratitude practice with folks that I see in my office, it's trying to be as specific as possible, right? So instead of saying I'm grateful for my family, I'm trying to tease apart and tease down to what really felt good recently. And so maybe it was something like I'm really grateful for the really tight squeeze my niece or my spouse or my sibling gave me that felt really good. And I feel their support with me. Or it could be seeking emotional support, calling up a trusted family or friend and just talking about the challenges that have come up. Maybe treatment didn't go the way that we were hoping, but having that person that you trust to really listen to what you're experiencing in the moment. And so by matching problem focused coping to controllable aspects and emotion focused coping to uncontrollable aspects, we can be really strategic in utilizing strategies that are going to be most effective for reducing stress. Sometimes I'll kind of teach and talk through this with folks, and they'll come and see me again and they'll say, Dr. Kirsch, I tried this out. This did not work. I don't know what's going on. But when we talk about it a little bit more and go down into the specifics of the challenges they experienced, sometimes, and I would say most of the time, we're utilizing the coping strategy that doesn't match. So, for example, there might be something that we initially appraise as being within our control. We try to problem focus, we're setting goals, we're trying to change all these things, but we're not seeing any change in the stressor. And we can feel stuck. And so that might be a really helpful indication, that feeling of stuckness of we're utilizing the wrong coping strategy. And let's try to switch it up and do an emotion focused coping strategy instead. Oftentimes, when we are trying to problem focus cope with uncontrollable aspects, it can feel like we are in our car, we've turned the car on, and we're in neutral, and we're revving the gas engine, but we're not going anywhere. We're exerting a lot of time and a lot of energy trying to control things that are ultimately outside of our control. And so if we kind of have those feelings similarly, it can be an indication of, okay, I'm trying to actively problem solve or engage in problem focused coping with something that might be outside of my control. Next slide. Okay. If you take away any of my slides from today, I hope this is the one that you take away. During cancer, many of the symptoms that you experience are normal, right? If we think about the first few slides that we went through together, it's very common to experience symptoms of anxiety, symptoms of depression, and just general stress as you navigate through your cancer experience. And those symptoms and intensity are likely to ebb and flow depending on where you're at in your cancer continuum. They're so normal that we expect them. I would be shocked if, someone came to me and said, I'm feeling really good now. I had no concerns before. I had no challenges when I was first diagnosed, and I have no worries in the future. That would be really unique and surprising to me, just because of how challenging and stressful this time period is for a lot of individuals. And it's significant. Oftentimes, when I'm talking with folks, this theme of discounting or discrediting our own experience or the challenges that we're having can come up. And individuals will say to me, I feel like I can't complain because I see someone in the waiting room that is way worse off than me, or I know someone who's navigating cancer and it's a more aggressive disease or a more intensive treatment, or they're navigating that and other stressors. So I feel like I can't complain. There's nothing that I feel like my emotions compared to that, my experience, are nothing. And I would gently push back on that and say, just because our experiences are different doesn't make them less than, and that it's really important to honor the challenges that we're navigating through, and also be able to open ourselves up to seeking treatment and assistance if that would be helpful. And so that leads us into the T, treatable, of our NEST acronym. And we've spent the last few decades looking at different non medication interventions to help manage symptoms of stress that occur in the context of cancer. And so, from that research, we have really strong evidence based treatments that can be helpful to reduce that intensity. One of those is called cognitive behavioral therapy. It's a framework, and some of the skills that we talked about today um, come from that framework. And it can be a really helpful kind of resource to be able to either talk with a professional about or research some skills at home. Next slide. Okay. I know that not everyone might be a Mayo Clinic patient, but I just want to briefly highlight our service at Mayo Clinic. And many other comprehensive cancer centers also have similar psychosocial supports. So I just encourage you to reach out to your team if you're interested in getting additional information about our psychosocial program. But the way our Rochester program works is it's available to anyone with a cancer diagnosis. It can be an order can be placed by your oncology team, and we provide in person and telehealth services. And so at that first visit, what we do is we just really talk about your cancer experience. What are the challenges that have come up? What are the side effects that you're managing? Whether it's pain, sleep difficulties, fatigue, in addition to maybe some of those mood symptoms that we talked a little bit about. And based on that evaluation or that meeting, then we work together to provide different recommendations that may be helpful for you. At the end of the day, we want to make sure any recommendation is consistent with your values and a good investment of your time and energy, because that is something that is a very precious resource. And so, some recommendations I have listed here. This is not an exhaustive list, but it might look like meeting one on one with myself or another mental health provider. We have a cancer stress management group. We often teach relaxation and health promotion behaviors, as well as evidence based interventions for common side effects from treatment, like sleep, fatigue, and pain. And then, because we're an interdisciplinary team, we refer to our colleagues in sexual health, integrated medicine, medicine as needed for whatever the challenges or concerns might be. Next slide. Additional resources outside of Mayo Clinic, like I mentioned, cognitive behavioral therapy is the first line recommended treatment. And so these are a couple resources to be able to find a mental health provider near your home if that would be of interest to you. This is not an exhaustive list, just a starting point to be able to find an individual. Each of these resources, they have a therapist finder zip codes. You can just type in your zip code and it'll populate mental health providers in your area. Another common theme that I talk with folks about is the stress that cancer can place on our relationships, whether it's spouses, partnerships, families. And so, if that's something that you're experiencing or would like additional support around, this resource, aamft.org, is another great resource to find an expert that that specializes in marriage and family therapy to help support you and your family as you navigate through cancer. We also have the Mayo Clinic Cancer Education Center, and I believe there are some QR codes being circulated during today's presentations. We have an online component, which is our Mayo Clinic Connect. And so there is a lot of other educational materials related to some of the things that we talked about today, as well as a lot of other things under the sun, if that would be helpful for you. Mayo Clinic Connect, you don't have to be a Mayo Clinic patient to be able to access those resources. And then finally, if relaxation resources are something that would be of interest to you, I have a couple listed here. I don't have any professional or relationships with any of these, but just again, kind of a starting point to explore if that would be of interest for you. Next slide. So I will end with this slide. We talked a little bit about discounting or diminishing our own feelings in the context of comparison to other folks. And we can often be incredibly hard on ourselves, especially when we compare to the grace that we give to the people in our life, whether it's our family or our friends. And we can be critical of the decisions that we made, whether we pursued this treatment over this treatment, or what would my life look like if I would have made this different decision? And it can be really easy for us to beat ourselves up and be hard on ourselves. And so this is just a gentle reminder to extend yourself the same grace that you give to your family and close friends. And that self compassion is an essential component of navigating through the cancer experience. We are all navigating life with the resources that we have and doing the best that we can in any given day. And with that, I will say thank you.